I'm excited to welcome to our world, Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. In today's topic, hand, foot, and mouth disease. Is HFM disease a virus?
Yes, it certainly is. It's a Coxsackie virus.
Who is most? Yeah, go ahead.
It is very contagious. Okay.
Who is most likely to get hand, foot, and mouth disease?
It's going to be young children under the age of 7. It's easily spread and very easily spread in daycare or in school, wherever there's a bunch of children together. It can be spread by handshakes, hugs, coughing, sneezing, kissing, and even poop.
What does HFM disease look like?
Well, it takes 3 to 6 days to develop symptoms after you come in contact with the virus. The initial symptom is going to be sore throat and fever. And of course, over the next few days, you'll get a reduced appetite, not feeling very good, and you'll have trouble eating and swallowing because of the sores in your mouth. So we call those sores herpangina, by the way. In adults, this is atypical. You don't always know whether you have HFM or not. So symptomatic relief is the best thing you do for your children and for yourself as an adult.
No, 100%, because it's something that definitely we should look at. How long is hand, foot, and mouth disease contagious?
Well, it starts and is most contagious in the first week that the symptoms are around. So, but it can be spread for days or weeks after the symptoms go away. So it's important to remember how you get HFM. And that, again, we talked about that. It's spread by droplets, coughing, sneezing, that kind of thing.
What are the treatments for hand, foot, and mouth disease?
Well, there's no cure, so you're not going to be able to go to the doctor and get a shot of any kind. And the only treatment would be if you have trouble breathing. Very few babies wind up in the hospital, actually, but like I said, 2% or less of the ones who get it. But again, symptomatic relief, Motrin, ibuprofen, Tylenol, but not aspirin. You can also use hydrocortisone salve. Some people even talk about using coconut oil or Epsom salts in a bath, baking soda sometimes.
All right. Such interesting information that Doc is providing. Next question. Can you get HFM disease more than once?
Yes, you can, unfortunately, because there are many different varieties of this Coxsackie virus.
Will HFM disease harm pregnant women?
Well, we don't know of any specific examples. There does not seem to be an increased risk for miscarriage, stillbirth, or birth defects. But if you think you have HFM, hand, foot, and mouth disease, call your healthcare provider and have a discussion. Most often, your symptoms will be much less than the symptoms of the children who get it.
All right. Best place to go is worlddocallen.com and pick up Pregnancy Away, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the World Doc Allen podcast, guys. Take care.